time to take our look at the injuries. Our injury report here with Dr. Kevin McHale. He joins us each and every week to take a deeper look at the injuries that are occurring each and every week in the NFL. He served as a member of the medical staff for the New England Patriots, and you look at all the injuries that happen throughout the course of a season. Yeah, some of them happen from time to time, or some of them keep popping up, but sometimes injuries occur more than one on the same team, and you wonder if a pattern occurs there. So we'll take a look at that as the Eagles have multiple guys with hamstring injuries. So we'll bring Dr. Kevin McHale here into the Sports Bash from Cape Regional Health Systems, and he's now with us on the Sports Bash 97.3 ESPN for another look at the injury report. Dr. McHale, welcome back.
Great. Thank you very much for having me.
Well, you know, the Eagles have a bunch of hamstring injuries, a bunch of guys standing on the sideline kind of looking around. So first I want to kind of ask, what causes these things? Why do these athletes constantly, we hear so much about it? I had a friend who played in the NFL, just couldn't stay on the field, constantly had hamstring issues. It seems like once you get them, you can never get rid of them. They linger all season long. So what are some of the things that occur for these athletes that are in such great shape that something like that can derail them?
Yeah, so first of all, you're exactly right. These injuries, unfortunately, are very, very common. There's about 150 to 200 hamstring strains a year in the NFL. And you're right, the recurrence rate's incredibly high. It's about 20% of re-injury rate after they get back to play. So it's incredibly frustrating. So what is it, and what are the risk factors for it? So first of all, when we talk about muscle strains, they typically happen all with the same kind of mechanism. It's when the muscle is being lengthened and there's a big load that's put across it. So in the case of hamstring strains, almost 3/4 of them happen to sprinters or during the act of sprinting, and that's because the hip is flexed, the knee's extended right when you go to strike your heel down to take that next step, and it puts a lot of force across the lengthened hamstring, and it puts it at risk to injury. So we know there's some risk factors for this injury, muscle weakness or relative weakness. Obviously, these guys are in incredible shape, but the imbalance between maybe the quadriceps compared to the hamstring or side to side, left or right legs can play a role. Fatigue's a major component when we're a contributing factor when we talk about injury, because the body's not able to kind of compensate for this quick force across it when they're more tired. So conditioning is incredibly important. There actually are prevention programs that are available, and most of these are incorporated across the NFL, so it's not something that's new. But it focuses on eccentric strengthening, kind of strengthening that muscle in that area where it's going to be tested the most during sprinting. But the most important thing is they do these progressive high-intensity interval training with acceleration drills and agility drills, and they're shown to kind of decrease the risk of recurrence after these injuries. That being said, why the Eagles are getting plagued by this, is a little unclear. Maybe they didn't do quite as much conditioning as they should have, I guess, in the offseason, but it's tough to see all these players go down with the same injury.
Just throwing it, diet, anything in that? Like, is there some kind of certain foods that help or hurt with that? Some kind of diet that you could change if you have hamstring issues? Something, a lot of times, a lot of health issues are connected to diet.
People kind of throw out these things like, anti-inflammatory diets, and there's a lot in the press about that. And it's possible that some of this stuff could help with trying to fight off these injuries. But there's not as much, research or at least evidence that supports that clearly one diet would prevent these. Otherwise, obviously, it'd be adopted across the NFL. What we do know is that some of these exercise training programs can decrease the injury rate in the first place and help decrease recurrence.
Dr. Kevin McHale, today's injury report brought to you by Cape Regional Health Systems. Dr. Kevin McHale, Cape Regional Health Systems and Penn Orthopedics, the best of both worlds for a healthier life. Call 609-463-CAPE or visit caperegional.com/orthopedics. Let's look at a term that we heard in the Philadelphia area with a basketball player, and that's Greg Olsen going the Jones fracture. In basketball, it's the dreaded Jones fracture. Greg Olsen, they say in about 6 to 8 weeks. It's interesting because we know with Ben Simmons here, 6 to 8 weeks meant the whole season.
Yeah, Jones fractures can be difficult things to recover from, and the reason is the Jones fracture, what we're talking about is a break of the fifth metatarsal. It's you have 5 metatarsals in your foot. They make up the arch of the foot. And the fifth metatarsal is all the way on the outside of the foot, lines up with your small toe. So it's a fracture at the base of this bone, and that's where the blood supply is the weakest. And as a result, it's been known to have a high rate of non-healing, and it's been a problem across many sports. So, and it's really important in these elite athletes because there's a lot of force that gets placed across there when you're doing cutting and pivoting motion. So what do we do? Typically, when we know that surgery itself will help speed up the recovery and get people back to playing quicker, so we put a screw across that. And there's other things we can do as well to kind of augment the healing process that try to speed things along. But we know, though, that it takes at least, about the 8-week time point to really for this bone to heal, but it takes a lot longer. But we have players getting back a little bit sooner just because we have these orthoses that they can put inside their shoe to help prevent it, to protect it, and some of these more rapid kind of aggressive rehab protocols to get them ready sooner. What you see is, the typical timeline to the typical timeline to healing is about 8 to 10 weeks, but the return that you see, players getting back between 6 and 8 weeks, they're kind of pushing the envelope, which is why we're having a little bit of a rise of these off-season secondary procedures, because the bone might heal, but it just doesn't heal quite completely, and as a result, they have these revision procedures later and a slightly higher risk of refracture. But, we try our best to get these players back as quickly as possible.
Last one in the football world here, Sam Bradford. I mean, he played well on the first week of the season, and then all of a sudden couldn't play last week. People were like, what the heck happened? And nobody saw anything. He had a bone bruise, and to the common person, okay, I got a bruise. Why is that so painful? Well, bone bruise kept an NFL player out last week. So have you ever dealt with a football guy with your time with the Patriots who came to you with a bone bruise, especially on the knee?
Yeah, so there's the bone bruise is an interesting thing. So first of all, the bruise itself is very painful. Okay, when you look at like an MRI, you see all this marrow edema, and you can see this. It just lights up because it's a very painful region, and the bruise itself does take a while for it to resolve, and it's just kind of a waiting game. There's not really too much you can do to speed up the process. What's more concerning, though, is, why did he get the bone bruise? And that's what's a little unclear. Typically, when we see just a straight contusion or bone bruise of the knee, it's from a trauma where you have a player that strikes into him, and that leads to a direct bruise at that site of impact, where a helmet might have struck the knee. In his case, it's a non-contact. Now, we do see bone bruises in other very classic patterns. So certain patterns are related to ACL tears when the knee twists, and as a result, there's a kind of a very temporary dislocation of the knee, and it impacts the femur in a way that the tibia actually causes a bone bruise. And some other ligamentous injuries can lead to bone bruises as well. As of right now, the reports say there's no ligament injury, but we know he had 2 ACL reconstructions on that knee. And
yeah.
I think the biggest concern would be if, what's the underlying cause, and hopefully they don't find out it's more than just a bruise.
I was going to follow up with that. How much did the fact that he had 2 ACL injuries on that same knee, could it cause problems?
Yeah, it's a huge factor because we know that, the ACL reconstructed knee, we're doing a great job trying to restore the normal kind of function of the knee joint, but sometimes there can be a little laxity that's still left in the knee after especially a revision ACL reconstruction. And that laxity, if it's allowing for that, what we call a pivot shift phenomenon, where the knee just kind of shifts, that can lead to bone bruises, but also can be a bad sign down the line if this recurrent kind of instability continues.
I got to ask you why we have you, because I know we didn't throw this one at you beforehand, but this news came out yesterday on Joel Embiid. His name comes up often in these injury reports, Doc, and they said he's not cleared for 5-on-5. And I guess my question is, this is traditionally meniscus, a 4 to 6 week recovery. We're now looking at 6 months removed, and they said still not ready to go. Red flags?
Yeah, there's a lot of red flags. So in general, the meniscus, although it seems like a very simple thing, it's a shock absorber in your knee. And when we see meniscus tears, there's a couple of options to treat it. If it's repairable, that's the best, right? We can do these repairs arthroscopically. It takes a while to recover from it, but once it's healed, you have that function of the shock absorber again. Now, I don't know what the inside of his knee looks like, but if there was a significant tear that was not repairable, sometimes you have to trim out that fragment, and now he no longer has that shock absorber there. We know that looking at meniscus tears in athletes, if they had a significant partial meniscectomy or a lot of that shock absorber is gone, there's a high risk of post-traumatic arthritis that can develop even at a young age, and it's just difficult for them to compete at that level. Typically, the duration of careers are shortened after a significant meniscus injury. So, yeah, it's very concerning, and it's definitely a red flag that he's not back to playing right now.
Yeah, I know a lot of Sixers fans gasping when they heard that the other day. Are you kidding me with this guy? So we'll keep an eye on him as training camp starts next week. Dr. Kevin McHale, Cape Regional, and we really appreciate the injury report each and every week. Cape Regional Health Systems, Penn Orthopedics, the best of both worlds for a healthier life. Make an appointment. Call 609-463-CAPE or visit caperegional.com/orthopedics. Doc, it's always a pleasure. Great insight again this week.
All right, great. Thanks for having me again. Look forward to next week.